Yeah, I've actually been with Spectrum Health since 2003. It was 2009. I became a breast cancer nurse navigator. Getting a new breast cancer diagnosis is just a very difficult and stressful thing. And most patients are uneducated about it. They have no idea about what treatments they may need, and just a million things are racing through their mind. And they say that getting that new diagnosis, or that time, is the most stressful time. From knowing that you have breast cancer until the time that you actually have a treatment plan in place. For patients, the role of the nurse navigator can be really super helpful. A lot of patients don't know what a nurse navigator is, or really don't understand how I can help them. But what I can be for them is that single person who can follow them from the time of their diagnosis. I can answer their questions even before their treatment plan is coming together. I can answer their questions as that treatment plan is coming together. And then if they have to have surgery, I can follow them, through their surgical experience. And then if they need chemotherapy, I can follow them through their chemotherapy experience. And then if they need radiation, I can also follow them there too. So I can really be that single person that they'll see during each aspect of their care. One of the most rewarding things that I get to do for me is just to be able to come along patients at the time of their diagnosis and just help them and help make things go as smoothly for them as possible as their treatment plan unfolds. What I'm able to do is help connect patients to what they need at the right time in their care. So it's really the oncology nurses, though, who have pioneered nurse navigation. And it was actually a brand new thing across the country, like in the early 90s is kind of when it started. But it's kind of a new thing that's blossoming at major oncology centers across the country. But I know that there's a lot of opportunity for, for nurses to help navigate any type of a chronic illness, such as diabetes or congestive heart failure. And I think there's going to be a lot of opportunity in the future where nurse navigation is going to be utilized even beyond oncology. I actually write a blog called Link to Pink, and that blog is intended really to be an informative and educational piece to the community. And I think that I heard that one month I had over 2,500 hits on that blog. And so really my goal with the blog is just to help get out those pieces of information that might be helpful to patients, either newly diagnosed patients or patients who have even finished their treatment plans. I'm always humbled and overwhelmed by the number of cards and things that I get with patients recounting how I've helped them. And and for me to know something that just is common knowledge to me and be able to share that with a patient and have that just make all the difference for them is just such a great, I just feel so great to be able to do that.